Good morning. So it's about 2:30 a.m. my time. So if I'm a little bit incoherent, just raise your hand. Tell me that I should slow down or something. My name is Gutman. I'm the founder and CEO of HealthTap. HealthTap is a network of more than 71,000 U.S. licensed physicians in good standing. 71,000 physicians in good standing that come to a digital hub to interact with people every day. We've served more than 3 billion doctor answers to date and tips to people all over the world from these physicians. And I'll tell you the story of what I believe is the future of healthcare and how the future is actually here, but it's not evenly distributed yet. And we believe that the future of healthcare is about the right care at the right time, at the right place, at the right cost. And how do we get there? Well, so I don't know exactly the situation in Germany, but I'm kind of guessing that it's not very different than what I'll show you now. When you go to see a doctor, you're not feeling that great. You say, oh, I need to see a doctor. I need to take some time. I need to schedule an appointment. Again, I'm not sure how it's in Germany. In the US, it takes a little bit of time to get a doctor's appointment. And a lot of time, this is what you find. I travel around the world. I give talks in places, and people sometimes look at this thing and they say, oh, yeah, that's pretty similar to what I see when you go to a doctor's office. And it's not only that it takes half a day and scheduling and finding the right doctor, but, doctor offices are kind of breeding ground for germs. Whenever someone goes to a doctor's office, it's because they're not feeling well. So it's not really the place that you want to go to avoid sickness. You're probably going to get something that you didn't have before. And also, like when you go and talk with the doctor, most of the interaction with the doctors is actually the subjective data that you provide to the doctor, right? There's a conversation, the doctor asks you a question, you say, oh, I had a problem in my hand, it's been going on for a couple of days, it's kind of blue, I don't know what to do, and then the doctor asks a question, you answer something, maybe they check your heart rate, maybe your blood pressure that has nothing to do with your hand, but then they have this light bulb coming up and they say, I know what you have this, here's a prescription, go take it, and all you exchange with the doctor was mostly subjective data. Where is the objective data? Where is real data that will empower the doctor to make better decisions? So where is the place in healthcare when doctors use a lot of objective data to make decisions? Anyone knows? Any ideas? So if you got to the place where doctors use a lot of objective data to make decisions, you're probably in pretty bad shape, right? So the place where they actually use data to make decisions is the ICU, is the intensive care unit. Why? Because most people don't have the ability to provide subjective data. So they rely more on objective data. But if you go to med school, how many doctors in the room? Yeah? You heard about SOAP methodology, subjective, objective, assessment, and plan. It's taught in med school as a methodology to document interactions with patients. Subjective data plus objective data that can come from a diagnostic test or from some sort of a device or a sensor or from a machine is added to the subjective data, and together they make an assessment. And the assessment will help the doctor make a plan. But in most cases, when you go to a regular doctor, they'll do mostly subjective data. And in order to get objective data, you need to go to the ICU. Or you go online and find information, right? So you go to a website and look for gastro, whatever it is, and then you get this page, and it has a lot of information there. And you get lost. And most people get really overwhelmed when you go to this website because like, oh my God, there's so much information there, but where do I start? What's about me? And I have a headache or I have a brain tumor. I'm not sure, right? So what do we do? How do we bring subjective data and objective data, making accessible to both doctors and patients in real time, and actually help people drive better decisions about their health and well-being? So let's see what will happen in the future. And once again, I will argue that the future is here. It's just not evenly distributed yet. So let's take an example. I'm a product guy. When I think about the future, I always go and try to find use cases, try to find friends of mine that are dealing with something that has to do with health, and try to see how we can use technology and build technology to actually help them deal with something that's related to health. And so meet Alex and Jane. They're young, they're happy, they just got married, and they have big plans for their lives. And what they want to do now, what do they want to do first? They want to go have fun, and then they want to have babies. So they're trying, they're traveling, they're having fun, they're enjoying themselves. A few months pass by, and the baby is not coming. So Jane is a little bit concerned. So she has a question. She wants to talk with the doctor. She's going to schedule an appointment. She doesn't have time. She needs to work, and she just doesn't want to do it. So she goes and finds HealthTap and thinks about, oh, I can find a doctor. I can contact a doctor now in real time from my mobile device and ask them a question. and I ask a question, and the doctor will answer me in just a few minutes for free. Let me try it. So she asks a question telling about the fact that she's trying to conceive and wants to get an answer if there's something wrong with her. And she wears an Apple Watch. She happens to wear one. And she gets a notification from HealthTap saying, oh, a doctor just answered your question. So she opens her phone, and she sees an answer from Dr. Teresa Johnson. And Dr. Teresa Johnson said, don't worry. Lots of women have tried to conceive. It takes a few months. Keep trying. It's fine. Nothing is wrong with you. If it doesn't happen within a few months, then we try to help you. And she's relieved. It just took 10 minutes. Other doctors actually weighed in, and you can see that 6 doctors agreed with Teresa because we were doing peer review on HealthTap. And she's feeling better. And she continues to try with Alex together. So on HealthTap, we serve more than 3 billion doctor answers and tips today to people everywhere. If you don't have the app, I really encourage you to download it. It's HealthTap on the iPhone or on Android or on the web. We actually provide tips from doctors, curated news, app reviews, checklists, and I'll tell you more about that, and also medication reviews. So if you want to see how medications are stacked against each other, how doctors perceive medication to be stacked against each other, you can try it there. But when Jane is trying HealthTap, she actually finds an app review about an app that can help her manage her health. It's basically a period tracker. And she thinks, oh, wow, if I can track my period now, and I can actually connect this app to HealthTap, I can then talk with the doctor and explain to them what's going on with me and share with them data about how I'm tracking my period and see if it's regular or not, and then decide when's the best time to conceive. So she connects HealthTap to this app that is not created by HealthTap, but was endorsed by more than 50 doctors on HealthTap, so she knows which app to choose among many, many period trackers, and she connects it in the back end to HealthTap, and now she can ask the doctor questions and connect the data to the doctor. But then she schedules an appointment after 2 months with a doctor to see a doctor, but this time she doesn't need to go and schedule a doctor appointment. She doesn't need to go to the doctor's office. She can do it at the convenience of her living room on an iPad. And then she gets a notification from us that her appointment is about to start. And she sees the doctor. She doesn't need to schedule an appointment. She doesn't need to just in her living room, she sees a doctor on her iPad, and it's at OB-GYN. We have doctors in 137 specialties in the United States, in more than 4,000 cities and towns across the country, so she can actually choose a doctor that she can actually see in the real room after the consultation online. So she talks with the doctor, and actually the doctor says, oh, it's been a while, and it's not happening. Maybe we need to check and see what happens. So he actually recommends to her to do a bunch of things, and rather than give her a long doctor discharge note that's written in MedSpeak and nobody is actually reading because it's cumbersome and has a lot of disclaimers and stuff, we condense it to a small checklist that the doctor has created for very actionable items that she can do, and we provide reminders to make sure that she actually does what she needs to do. And the reminders goes to her cell phone by push notifications, by SMS, or by email. She can choose whatever she likes. Or it can actually go to a watch if she wears one. And why is that important? Beyond the fact that the watch is cool, it's also very effective. How many people wear an Apple Watch or an Android Wear? A few, yeah? So the notification on the skin, we're actually engineered as humans to react to very small changes on our skin. And the reason is because it used to be a survival mechanism because, mosquitoes used to do all kind of funny things to human beings, so if you have a change on your skin, you actually react to it very quickly, whereas the phone is in your pocket if you're a guy, or in your purse if you're a woman, so the notifications are not that effective. As a product guy, I was very excited about the watch because you cannot ignore the buzzing on the skin. And then all you need to do is this, rather than pull your phone and turn it on and see the notifications. And the work that I did at Stanford was all about adherence in medication. And the number one reason for people not to adhere to medication, which is more than 50% of the time, is because they forget, which I'm sure happened to you as well. So that this quick notification on the watch is actually very effective in reminding people to do what they need to do. But even more than that, if I go back to my research, we found that if you get a notification from a loved one, so from a doctor is very effective because you trust the doctor, but if you get a notification from a loved one, it's actually even more effective. So we actually send a reminder to Alex to remind Jane to do other things that she needs to do beyond taking folic acid if she wants to have babies. Maybe she needs to remember to. And he said, yeah, I will remind her, why not? And he just pushes a button and sends her push notifications on her watch to do what she needs to do in order to conceive. And then they move to the messaging app, and she can actually talk to the watch, and he recommends this. And she responds this. And then 9 months pass by, and voila. So it works. So the whole notion of connecting, right? So what's next? What will happen in the future? So this is very reactive, right? So you come to HealthTap, you ask questions, you find doctors' answers, you get tips and reminders and all these things. It's fantastic. But we believe that the future is actually proactive. In the future, we will use data in order to anticipate things before you think there is a problem. Jane went to a doctor because she perceived to see a problem. We believe that in the future, because we have your data, we will be able to anticipate what's coming up even before you feel you have a problem. And I'll give you an example of something that is actually we're working on in HealthTap Labs and give you a glimpse of the future for a second that we haven't shown yet around. This is something that you may have seen already. It's a company called MC10. It's actually creating today like these kind of little patches that you don't need a wearable device. You can actually put it on your skin, and it's self-contained. It has all the technology that you need in order to collect a lot of data from your environment and submit it ubiquitously to a cloud that then this data can be interpreted and actually give you good recommendation. But we believe that machines should not give recommendations to people regularly and should not give recommendations to people without passing through a doctor. What we want this data to do is go, just like in the ICU, go to a doctor that will be able to look at it and in context give you recommendations that are very valuable. And it's not as expensive and life-threatening as in the ICU, but it can happen on an ongoing basis in a service like ours that has tens of thousands and maybe eventually hundreds of thousands of physicians that can be available to review these data. And I can give you a glimpse of a dashboard of a physician. This is a real dashboard that we're working on right now, of a physician that can actually see the data in context. And you know, Jane has asthma. And every dashboard of a person that will be presented to a doctor will have several data points that are relevant to managing the actual health of this particular person. And as you can see here, on the physiological state dashboard, the doctor can see the respiration rate of Jane. And Jane just went to a camping trip with Alex together. The baby is now a little baby. His parents came to stay with the baby a little bit and give Jane and Alex a little bit of time to relax, and they went camping. And she has asthma. And the doctor looks at the dashboard that has respiration rate, heart rate variability, blood pressure, and he sees that something with the respiration rate of Jane is not so good. She's sleeping at night, but he's not very happy with what he sees. You can also see how the intervention working, and you see that she's using an inhaler, and she's using it regularly, and she's taking one puff every time that she's not feeling that well. She's feeling great while she's sleeping, she's not aware of it, but something is going wrong. And the doctor got a notification about that, and now he can give Jane a notification, an alert to increase the albuterol inhaler to 2 whiffs, and now she's going to actually prevent an asthma attack that she wasn't even aware of because she knows what to do. And that's very powerful. That was inexpensive to do. It's a very realistic use case that can happen today, right, and prevent something that Jen is not even aware is going to happen. So we're going from a present of good access to doctors, asking questions, getting access via video, and getting immediate access, but it's reactive to a future that is proactive, when we use data to help doctors and people make better decisions about their health and well-being and live healthier, happier lives. And that's not just in asthma. That can be in things that are related to losing weight, sleeping better at night, managing pregnancy, but also managing conditions like cancer and diabetes. So thank you for your time. It's been a pleasure, and have a wonderful day.